Good afternoon, and thank you for joining us for today's webinar, How Project Aware Can Bolster Student Mental Health. We're happy to be able to share today's presentation with you as you all prepare your upcoming grant applications. Before we get started, I have just a few housekeeping items to run through. Today's presentation will be recorded, and a copy along with the slides will be sent to all registrants. Attendees are in listen-only mode. However, if you'd like to chat with us or ask a question during the presentation, you can do so on the right-hand side of your screen in the GoToWebinar control panel. Finally, we invite you to connect with us on social media by tweeting @Cognito or using the hashtag CognitoWebinars. I'd now like to introduce today's presenters. Perry Blankenship is the Coordinator of Student Services, Attendance, Nutrition, and Mental Health and Project Aware for McDowell County Schools. He has worked in clinical counseling since 2011 and has, as the Director of Mental Health Services, served as a therapist, school counselor, and vocational rehabilitation counselor prior to his current position. Perry is a 100% service-connected veteran of the Persian Gulf War, and he holds bachelor's degrees in theology and pastoral counseling, as well as a master's degree in psychology, divinity, business administration, and education. He is currently enrolled in the Educational Specialist Program at Marshall University and a doctorate of pastoral counseling program at Anderson Theological Seminary. He is also the pastor at Fincastle First Church of God in Bluefield, Virginia, the clinical supervisor for an alternative sentencing program in McDowell, West Virginia, and a volunteer chaplain at Princeton Community Hospital. He is certified in numerous fields of training and a trainer for numerous prevention and intervention programs. Sabrina Johnkoff is a passionate advocate for mental health and is grateful to be a part of a company that uses technology and conversations to improve social, emotional, and physical health outcomes. After joining the Cognito team in 2019 as a business development representative, Sabrina now oversees K-12 clients across states in the Midwest and Northeast as a strategic account manager. And with that, I will turn it over to Perry.
Hello, everyone. Go ahead and advance to the next slide, please, Scott. I really appreciate the opportunity to talk with everyone. Project Aware is a program that I've been very passionate about because it has opened many doors for our school system to be able to connect with SAMHSA and all the mental health resources that they provide, and also the community resources that we find in our local area. So when we think about the Project Aware grant and we think about what it was doing, SAMHSA, wanted to help us to be able to build our Tier 1, Tier 2, and Tier 3 support systems. So we look at that whole school, that holistic piece, then we look at those groups, and then we break it down to individuals, making sure that we are helping students with their social emotional needs at every level and from every angle. And so SAMHSA sent out this grant a few years ago that when I became a part of it, and the ideal of it was to increase that awareness because of that stigma and because of the things that are taking place within our school systems and within our communities. And we know the awareness of mental health has definitely increased with this current pandemic. So we wanted to provide our people with training. Our school counselors, our social workers, and some of our teachers have been trained in a variety of mental health services, interventions, preventions, and so that it has enabled us to be a strong school system for our students. We had to make sure that we were able to do it in a way that would connect every child at every age level and grade level with their needs, and be able to specify all of the things that we were doing in a way that they would understand. Sometimes we use terminology, whether we realize it or not, that are above other people's heads. So we wanted to make sure that we broke that down to meet their needs. And so building that connection, make sure that we're connecting in every way. And so with Cognito, I was glad to bring it on as a part of this, because I found the connecting tool for my staff and my students really was increased once they had the open door to the platform of Cognito, so that they could see with themselves in their own time what was out there, what was available. It helped them to interact. My teachers, before using Cognito, would ask me, how do I talk to my students? What questions should I ask? Cognito gave them that voice, and it helped them to be able to do that. Next slide, Scott. So we were awarded our grant back in early, let's see, this is 21. So it would have been probably around 2015 we received our grant. And it ran for that 5-year period. And so each year I found the funds to be beneficial. One of the things that I learned though about this award grant is making sure of that sustainability, how to sustain our program. So we was able to use the funds that we received in a variety of ways to sustain us at all levels with different people. Okay, next slide. So for us, it became a very powerful tool. McDowell County at one time was one of the richest counties in the nation. We had over 100,000 people in our population. As you can see on the screen, that has changed over the recent years. We are now one of the poorest counties in the nation. We have just under 19,000 people in our population. We look at what's taking place, and so we think about the employment and the impact of poverty. And of course, we have a big addiction problem that's a barrier. We have a lack of employment now that's a barrier. And so when we look at it, we think about how that each individual is impacted. For us, over 50% of our children are living with someone other than their biological parents, which is a major thing. So we have a lot of grandparents who are now raising their children. And so we think about that. We are a county that is 100% breakfast and lunch free. And so that's where our poverty rate is. If you know what Title I schools are, the majority of our schools are Title I schools. Next slide, please. So when I think about the different components and how that we were able to meet the needs, we had to make sure that we were bringing in not only the student, but the whole family. So we had to find ways to reach the whole family, the grandparents, the parents, the aunts, the uncles, the cousins. And so we've done a lot of different things within the branch of Project Aware. One of the things that we've done is our visitation program. And so because of that visitation program, we were able to connect with families. Another thing we do is we work with grandparents. We have grandparent time. And so they come in and we do training specifically with them. And then, of course, with our youth and our stakeholders, we have a lot of community stakeholders, and I sit on many of those boards. And so we pull together our resources to see how that we can strengthen one another. One of the programs that we used was mental health first aid and youth mental health first aid. And if you've not experienced that, that would be a very good program for you to be a part of. I'm a trainer for that as well. And so we train our staff into how to identify the possibilities that someone may come to that point where they decide to complete suicide. And then we looked at building the resiliency. So how do we do that for our families? So we looked at how to support the family. Again, we looked at tearing down stigma, because I come from a very religious culture that when I first came back from Desert Storm, who believed that seeking out help for mental health was actually a sin. And so we have worked very hard in changing that stigma in our area to help people understand that we are not replacing their God, we're not replacing their belief, but we're giving them the tools and the strength they need to make themselves better and to help their children become better. We also pulled in, again, our school and community partners. So Cognito's been a great partner of ours for a long time. They've really helped us in a lot of ways, along with other partners within our community and other places that we have worked with on a daily basis. Next slide, please. So when we looked at it, we think about the statistics. We think about how one out of every 4 children attending school have been exposed to some kind of traumatic event. And I'm sure that most of you have looked at the ACEs and how the ACEs has become a big part of trauma. We've called ourselves trauma sensitive schools. We've called ourselves trauma aware. So I want us to become that place where we're doing more than just talking about trauma, but we're actually doing something that can help treat the trauma issues that are the triggering factors for a lot of our behavior issues. So I like this quote here. It says, "Our brains are sculpted by our early experiences. Maltreatment is a chisel that shapes a brain to contend with strife, but at the cost of deep, enduring wounds." One of the good things that we do know about trauma is that because the brain is elastic, that we can remold or reshape that, so we can change those neurotransmitters to be able to build new neuron pathways that gives that healthier lifestyle or that healthier choice to that child. But it takes those relationships, and so that's where this program really comes in good. So when I think about that, I think about the peer-to-peer piece of Cognito, that so that they can do friend to friends and connect with one another and how to connect. And so that's a big piece that Cognito helped us to do, is to build those relationships. Next slide, please. So when we looked at our barriers and all the challenges that we have in a rural area, and I'm sure that some of you have those as well, and we had that challenge that for people to access mental health. So when I think about the qualified people here, we have a challenge, not just as a school system to find qualified people, but any professional staffing within our county is a challenge, because a lot of people here do not have the education. And so we end up finding ourselves having people driving an hour and a half to 2 hours to come to our schools to provide services. One of the things that we did do to overcome that barrier prior to COVID, I'm glad we got ahead of this, but prior to COVID, I was able to set up telehealth therapy in every school and made it available to every staff and every student. And so we got ahead of the game. We was doing telehealth before it happened. And that's because of my background in mental health. That's what we were doing when I came from the mental health clinic. But, of course, there's still some stigma surrounding mental health and receiving services. And so because because I had those relationships built in my community, I already had the respect of a lot of the parents. So I'll call them up on the phone myself and just go over with some of their concerns, some of their questions. And the number one thing that I run into for most people is, am I going to lock them up if they get signed up for mental health services? And so I have to reassure them that's not what we're doing. We're not here to lock you up or get rid of you or to take away your children, because a lot of people are afraid of CPS. They're afraid if they get that their child has to have mental health services, that automatically means that CPS is going to be involved. So reassuring our families and strengthening our families is a big piece. People have difficulty in our area, of course, with transportation, but again, with the telehealth services that we're providing, they can do it on their phone, they can do it in their home, they can do it at school. So we are providing in multiple ways in multiple areas. Next slide, please. So here, one of the biggest challenges that we ran into is our significant turnover rate. And I don't know if you folks have experienced that in your counties or your districts, but we have a big overturn rate. Our county, because we are a poor county, there's not a lot to offer. We have become that county where people come to get their experience and then they go to other school districts. So one of the things that I did ahead of time with the monies that I would receive from Project Aware is I became a trainer for the things that I wanted my staff trained on. So that way, if I had turnover rates, I was not bringing in new trainers. I wasn't bringing in a trainer every year to get those new people. I was able to do that myself, which cut our cost greatly. So when I think about that and I think about the retention rates and the things that we have in our schools, we have done a lot of good things. And because of that, I now am attracting good school staff that can do mental health services, because we do offer these services here in our county. We are one of the only counties in our state at this time who is doing a lot of the programs that we're doing. So we are definitely ahead of the game of that. And again, Project Aware made that possible or available. There has been, but prior to Project Aware, there was a lack of funding to support a lot of the things that we needed. And so we had to be very cognitive of that. And so one of the things that we had to think about when we were bringing in mental health providers is that we did not use Project Aware monies to pay for mental health services. We had those providers establish a self-pay or bill through their medical insurance pay. We did not pay for services because I had a neighboring county that did pay for services, and now they're struggling to find funding to continue those mental health services for those students. So just keep that in mind as well, so that you're thinking about longevity. What's going to last? What's going to be the biggest impact? Next slide, please. So you can see we do a lot of services. We are doing, of course, the Cognito. We are doing the PBIS, the early childhood PBIS. We are using Too Good for Drugs, Too Good for Violence, Coping Cats. We are building up on Second Steps. You name it, the program's probably here, and I've learned how to blend those programs. We are Oveus people. We are doing the Oveus program now. And so we are doing a lot of different programs to hit bullying, to hit all those social emotional needs. We have 2 schools that fully implement community schools, but now we have 4 more that have community in schools, which is 2 different programs. And so we are moving more and more towards that mindset that the community has to be involved and has to be able to access our schools. Of course, COVID has set us back a little bit with that because we have to limit our access. But once we get past COVID, we will get that back rolling again. Of course, again, we do that family advisory program. We have Second Time Around, which is our grandparents piece. We have open houses, parent nights. We're doing everything that we can to reach out to families and to students. Next slide, please. So this, again, as I mentioned earlier, the empowerment to be able to talk to our students was very vital, because for a lot of people, and I can tell you before I got in mental health, I would have been very uncomfortable talking to some of these students about some of the things they bring out. Because being a school counselor, I can tell you, I have sat in my office and heard some horrific stories that make me wonder, how's this child even functioning? Of course, I didn't say that out loud to them, but it makes you wonder. And so when you're a person who's caught off guard and you have a child who's thinking about completing suicide, or you have a child who's wrestling with depression, how do you address that? How do you meet that? And again, like I said earlier, Cognito helped me to empower the voice of my teachers and allowed them to learn, because I like that interactive model where they can get on our practice. And so the good thing about it is they were able to do that from the comfort of their home at their own time. Of course, now one of the things that we did do with Project Aware monies is we did offer a stipend for every staff that completed their Cognito training. So I think that's a good tool to use for your money, is to offer stipends to your staff. If you complete this journey and get your certificate, that we will pay you so much to complete it. And believe me, that gets great buy-in. Anytime you offer money, it gets good buy-in, of course. Next slide, please. All right, so one of the things that we did in introducing the Cognito model is I went to my principal's meeting. And of course, you have to make people think it's their ideal. So I went into the principal's meeting and done my spiel as getting them to understand of how important this is. And I know you have these needs and you don't have the time to talk to every staff or every student, and this is how it's going to reinforce you. And believe me, I was able to get good buy-in once I showed it to them in a way that made them see that it was going to make their job easier. And then, of course, we wrote it out with principals and counselors first, so that our administrative staff and our social emotional team would get the feel out what it looked like, so they could support other staff. And then, of course, it was a voluntary basis, but they did get paid. Some of them got a half a day professional development day, and so we used some of those days as well. We used the Cognito templates to promote and instruct how to access it. The one thing that I can actually say with Cognito, they gave me all the tools that I needed and supported me to give this to my staff to be able to promote it. So they gave me those promotional tools that I needed. So I think about how each one of them earned that stipend. They had that 2 hours, and again, they got that certificate of completion to give to me. Next slide, please. So when I think about, of course, Cognito, I think about how that we are working together, and I like the introduction that Scott gave about Sabrina and about her passion about mental health and about that social emotional needs. And so I think about that combined mission-minded mindset that we have, that ability to work together and understand the need and the sincerity of being able to reach people and be sincere about it. So I think about how that this tool really gives that simulation in a way to where they can really feel that social, emotional, and physical health that is needed by our students. Next slide.
I think this might be my turn to hop in. Thank you so much, Perry. Really for Perry and for everyone on the line, I consider myself very fortunate to spend the majority of my days, speaking with people who are, so amazing and passionate like Perry and like you guys who made time to join. I know this is a more hectic and stressful time than ever before, so we're really grateful for for all of your efforts. So Perry gave a great overview of Cognito. I want to talk a little bit about kind of our current focus and our current product offerings. We'll see how far we get, and then we might do a brief demo of the student-facing product that Perry mentioned. Either way, if we get to the demo or not, you guys will all be receiving a link to the full content of that simulation, as well as the trauma-informed practices simulation that Perry mentioned. So I really just want to stress that Cognito's programs focus on the target skills through the lens of essential topics, including mental health and suicide prevention, but also, things like trauma and grief and bullying. The overarching goal, really similar to how McDowell County is approaching their whole community, is to provide that kind of community and holistic framework that positively impacts school climate and culture. So you can see here just kind of like a grid of all the products that support each grade level. We support early childhood through high school. We also have higher ed products. And then, for communities maybe like McDowell County or others, we also offer some substance abuse prevention products, including a screening, briefing, and intervention simulation. Next slide, please. So the friend-to-friend SEL suite is what was mentioned. The current one is just called Friend-to-Friend, and it covers mental health and suicide prevention. And in the next 4 to 6 weeks, we'll be launching the substance use prevention module, also known as alcohol and other drugs. That's really going to help kids, engage with their peers to talk about those complicated conversations. And then later on this year in the fall, we're going to have a school violence prevention module. These are things that have been asked for a lot, and combining them as a full SEL suite has just made a lot of sense for how we're approaching, students in the school community. I think that for Cognito, we have this idea of a gold standard kind of an implementation, and being able to, really train everyone in the school community is what will set everyone up for the greatest success. Let's go to the next slide, please. So this is going to be, we'll hold on 1 second, Scott, for the virtual practice. What we're going to jump to, we'll just do like a minute or two of this, but prior to where we're going to jump into, there's a whole didactic portion. That's just going to be a coach. The coach is very approachable, talks about things. So, like Perry mentioned, in the trauma simulation we have, the coach is going to go over ACEs and let you know what adverse childhood experiences are and really what to look out for. I think that we make this really approachable for both adults and students. For adults, we're not trying to turn anyone into a mental health professional. That's why people like you guys, and that's why people like Perry already exist. We just need to build that additional layer of, of support so that you can make, a warm handoff to the appropriate, service of support. And for students, we want them to know all the resources that are available. So, what level of conversation should we maybe really escalate? Which kind of level of conversation can I just handle with you peer to peer? So Scott, let's just jump in quickly to that and see a little bit of the functionality. Awesome. So we're chatting with Anna. We should be able to hear them in a minute.
So I was watching you guys play out there. Nice assist.
Hey, thanks. So what's up? Just watching practice?
Yeah. Had some free time before I pick up my sisters. You guys are looking good.
Oh, yeah? See anyone you thought looked really good? Like maybe Lucas Miller?
Shut up, Michael.
Anyway, glad to see you out here chilling. Seemed like you were pretty stressed out at lunch. things with Robbie got kind of intense.
Yeah, I'm sorry about that. I didn't mean to get mad at Robbie. It's just he was being so annoying, going on and on about his math test. I just couldn't take it anymore. He just doesn't get it, you know?
So then, that just kind of gives you an overview of, kind of what our virtual humans sound like, what they're talking about. We've had hundreds and thousands of students complete this, and, the fear with teachers is always like, oh, well, they think it's dumb, will they buy in? And there really is a lot of buy-in, because a lot of barriers for learning are removed when you're doing it in a virtual simulation. So we're going to try to connect with Anna and see how we can support her. So right here is the talk functionality. You'll see on the bottom of the screen there's an engagement meter that is going to fill in as you move through the conversation. And then if we go back to the talk icon, we have a couple of options. So we can make an observation about Anna, or we can get some more information. I like to tell people that this isn't an assessment. There's no right or wrong necessarily. There's just more and less compassionate conversation selections. And if you make too many, less compassionate selections in a row, you will get a bit of a force undo. But the cool thing is that you also get an option to just undo yourself. So I really encourage people to play around with all the options to see how these virtual humans who have memory and are, physically and emotionally responsive, really how they act. So let's do something that maybe is a bit abrupt and maybe not ideal with the something's up. You've got to tell me what's going on, and just see how she reacts.
Okay, something's obviously up with you. Tell me what's going on.
What do you mean?
I mean, you know what I mean. Something's up, so tell me.
I'm fine. I'm just tired.
Anna, just tell me what's up. You can tell me.
What is this, an interrogation?
So that maybe wasn't the best choice. We, in the didactic portion, the kids will see some information about why it's great to ask open-ended questions, and other different skills that they can utilize in these types of conversations. The little thought bubble above Anna's head is just going to give us a little tip inside her internal monologue, and that's going to really come up if she didn't respond, super great. So that just kind of gives you a quick idea of what this is all about. Again, I think Cognito simulations are best experienced on your own. So everyone will get a link to one for students and one for staff members. But Scott, do we have any questions? I think Perry and I might be able to answer one or two.
Yes, let me see what we have here down in the questions section. I pull the slides back up here. Thank you both very
Perfect.
much.
Thank you.
So the first question here, Perry, I think this would be for you. The question is, how well do staff see the value of the simulations? Do they feel as if they are more prepared when they take them?
Yes, once they took those, they felt that they were more prepared to talk with their students and meet their students. Because I know in West Virginia, we are obligated by law to talk about suicide. And so a lot of my staff felt uncomfortable about the questions that would come up after the presentation, because they, I would go in as a counselor, do the presentation, leave the room, and then they're left with the questions. And so every one of them that I talked with said that this helped prepare them to be more ready to answer those questions.
Awesome. And Scott, I think I see a question about kind of the face-to-face programs that Perry mentioned. And I just want to comment on that briefly, that those programs, like the few Perry mentioned, mental health first aid, youth mental health first aid, are super valuable. They're obviously challenging to do at the moment with the pandemic, but in normal times, we have so many school communities who will do programs like that and pair them with Cognito, because we really are a complementary and supplementary tool, especially in terms of scalability. I know that the cost of some of those programs and the the time commitment can be kind of overwhelming for, you know, getting a whole district trained in something. So to be able to kind of tackle that and have, you know, 2 sources of trainings at the same time is really great for the staff.
Great, thanks. And there's just one more question here. How is this? How are we able to access the simulation? How is it rolled out, and are students able to access this on their own?
Yes, yes. So everything is just accessed with a normal web browser. It's all mobile compatible. So if they have, you know, their Chromebook or an iPad, whatever they're using during remote, they can use that. Same with teachers. You just need a web browser and an internet connection. And we also have some options that will allow schools to kind of integrate it with their LMS if that's something that they're interested in doing.
Great, thank you. And it looks like we are at time. I want to be respectful of everyone's schedules. So thank you all for joining us. I will let Perry and Sabrina give their closing thoughts.
Perry, you want to take it away?
Okay, well, you know, I've really enjoyed the time today. Good questions. There's a lot of good answers out there for how to address different things, but I think Cognito is a good place to start.
Thank you so much, Perry. And, you know, thank you for joining. Thank you everyone on the line for joining. Our information is right there. Feel free to reach out to either of us. You'll be receiving some follow-up from me after Scott sends out the recording and some of those resources. And we look forward to connecting and learning more about your districts and how we can support you.
Yes.
Awesome. Thank you so much. Thank you, Scott. Thank you, Perry.
Thank you, guys.
Bye-bye.
Bye-bye.
Bye.